My story starts when I was sophomore in college, and I started to get severe pain back behind my neck on the left side. It was debilitating and just kept popping Advil, pain pills, would work for a little while, then not work. And I just learned to live with it till about 10 years ago. And it just got so severe. I had severe pain in my left ear and back behind my left eye. I had facial numbness on the entire left side. Totally messed up. Headaches all the way around my head. Couldn't pinpoint why they came on, what was going on. So I went to ENTs, I went to eye specialists, went to oral surgeons, CT scans, MRIs, every test you can possibly think of, and they looked at me like I was crazy. There's nothing wrong with you, you do not have an ear infection, and there's nothing behind your eye, because I was completely convinced that I had some sort of a tumor that was just growing. So went to the oral surgeon, and he said, you know, there's really nothing I can do for you. You need to go to a TMJ doctor. Okay, fine. Went to the TMJ doctor. He told me I had arthritis in my joints, and I needed to get into a splint. Not a problem. $5,000 out of pocket. Didn't care. I'll do whatever I need to get out of pain. At this point, I had kids, and there were weekends where I didn't want to get up and do anything. You know, I would come home from work. I had given all my energy, you know, smiles and energy to the patients, and I just couldn't do it at home, you know, and I was completely missing out on watching my girls grow up. Went through the splint with the TMJ doctor in Dallas. Went away for about 6 months, and after about 6-7 months, it came right back and reared its ugly head. Pain in the left ear, pain behind my eye. It was awful. I mean, I would just go home and cry, and doctors just look at you like there's nothing wrong with you. So I was convinced I'm going to be like this forever. Doesn't everybody have headaches? You know, doesn't everybody have pain behind their ear? And I figured I was a lost cause, so I just pretty much gave up. It's been really bad, and it started so long ago, and it's just kind of progressed from the pain in the back of the neck to the ear pain. And I'd walk around like this to relieve the pressure from my ear. We started the program about 3 months ago and found out that I was a class 4, the most severe, not a huge surprise to me. I've gone through 3 therapies, and I can tell you that I do still have some of the headaches. The pain is not near as intense. I do not have the numbness on the left side of my face anymore, and the pressure and pain behind my eye, while it's still there, it's almost minimal, and it has been life-changing. You know, there's nothing worse than not being able to function because of, you know, a headache or pain behind your eye. You just want to, you know, do this and lay down and not do anything. It's completely debilitating, and this program has changed my life, and I'm excited to progress, get into my appliance, you know, take all of my take-home machinery, you know, to do, and I'm very, very excited. I hope that, I mean, this is something that I will follow through with for the rest of my life, because I want to get better. You know, it's not just about headaches, it's about your life and regaining your life back to, especially, you know, if you're missing out on family events or watching your kids grow up. It's horrible. I mean, there's nothing worse. So I'm very excited to progress along and continue my therapy and share it to the patient, with the patients. This is a miracle worker. I mean, really and truly, you know, I think every patient that I have should be on this program. You know, whether it is for bite-related issues, whether it is for jaw pain, neck pain, because it's life-saving. And I think too many people ignore their headaches and ignore their symptoms because they think that's just the way it's supposed to be, which it's really not.